Dr. Siegel, the president made some promises about Obamacare. You can keep your own plan, and every family on average $2,500 less, and we're not going to have death panels. Is that true?
No, it's not true. And I live Obamacare every day in the examining room, Sean. And you know what I see? We promised Americans better health care. We got them more expensive insurance. We promised them more doctors and nurses. Instead, we got more IRS agents. This entire law is about expanded insurance, too expensive. We can't afford it. Our patients can't afford it. And the ones that told me, the ones that were on the fringe, that said to me, I can't wait till this law comes because I'm going to have coverage, be able to see you. Now they're ending up with part-time jobs. They're ending up worrying about whether they're going to have insurance at all.
Right. Steve Forbes, you are one of the best money men in the country. You understand the finances of this. Will businesses really not be able to hire full-time workers? Are they cutting back on full-time workers as a result of not wanting to meet that 30-hour requirement?
If you're a small business, absolutely. Your margins are small, therefore you don't have the ability, if you have a large profit margin, to do this. And in the face of uncertainty, you hold back and see how actually this thing is going to unfold. Bigger companies, our company is suddenly facing taxes this year and next year that we didn't really know about, and now we're learning about it. So everyone is getting hit by unanticipated costs and just sheer uncertainty, and that hurts hiring.
Sally, you support this law.
I do. I mean, first of all, look, we needed to do something in this country about runaway costs of health insurance, as well as the 35 million uninsured people. President Obama put forward a plan. It was a plan that came originally from Republicans. They liked it when it was a Republican plan. And it's done things that the American people...
pushing this plan?
Oh, come on. You know, it came from the Heritage Foundation and from John McCain. Since then, it's done things that the American people like. They like that their kids can stay on the insurance longer. They like that seniors are paying less for prescriptions. They like the rebates they've gotten, that pre-existing conditions won't throw people off of insurance. It's popular, and this effort to keep repealing it again and again and again instead of doing the actual business of the people that needs to be done.
There's nobody that I know that knows this law. She's read it. You've read every page. How many times have you read this law?
I read this law, so you don't have to, Sean.
Thank you.
Betsy McCoy, author of Beating Obamacare. And I would say this, the positive reforms that Sally just mentioned are in the first 30 pages of this 2,572-page law, and virtually everyone in Congress would support making those reforms. But the next president of the United States should take a pledge that he or she will not sign any bill into law if it's over 20 pages or it contains all this gobbledygook, because it means that we don't have a democracy. And the Washington politicians keep saying they want comprehensive health reform, comprehensive immigration reform.
How much does that thing weigh, by the way?
You know what comprehensive means, Sean? It means unread. That's what it means. The framers created our entire federal government in just 18 pages.
What about
20 pages should be enough.
Who wants to comment on the actuaries that have determined it's going to go up? You want to, in California, 164%, 88% in Ohio.
Well, the actuary, Sean, is a big deal because when you look at how the law was calculated, and that's why you need to put the brakes on, the unintended economic consequences of Obamacare are a disaster. What employers are doing to switch to part-time, what insurance companies are doing to raise premiums and game the system, what doctors are doing to reject Medicare, and what ACOs have now failed in the experiment, all of the assumptions on which the law was passed, saying that it's actually going to save money, are completely flawed. So the CBO needs to go back and recalculate that because the economics are wrong math.
Well, the original estimate was $900 billion. Remember, the president tried. The latest CBO number that I saw was $2.8 trillion. The number's going higher. Is that a broken promise?
Well, here's the thing. We really need to go back to this point about the actuaries, because the law is called the Affordable Care Act, but it drives up the cost of insurance by a dramatic amount. In states like California, in Texas, and Florida, in nearly every state in the union, the cost of individually purchased insurance is going to go up by 40, 50, 100, 150%, depending on the state.
160 in California, right, Betsy?
That's right. And why is it going up? Because these premiums are going to include $100 billion in taxes. When you write that check for your premium, a lot of it's not for your health care. It's for new tax hikes.
Yeah, all right. Go ahead, Monica. Go ahead. I'll get to you, Dr. Siegel.
Let's take a step back and remember what this is really about. Let's take a look at the big picture. Obama in 2008 spoke about the fundamental transformation of the nation. Healthcare was his greatest lever in order to affect that. That's why he did it immediately. Obamacare was never about healthcare, health insurance, or health reform. It was only and solely, and still is, about about government power and control. When you look at the history of authoritarian regimes, one of the first things they do when they seize power is seize control of the healthcare system for one simple reason. If the government controls your healthcare, the government controls you. Period.
We're going to get into this more deeply. I'm going to bring up the case of that 10-year-old girl, Sarah Murnahan, in just a minute. Tim.
Yeah. Back on the issue of cost for a minute. The Obama administration admits that this thing is going to be funded on the backs of young Americans, folks under 35 years old, men and women. That's their only chance to fund this new Obamacare.